started in the interest of time and also to get to this good information. My name is Paige Michelle. I'm the incoming president at the Texas City Lamarck Chamber of Commerce, and I'm very proud to be introducing our featured speaker today. We have with us Belynder Ouko-Kendrick. We call her Belle, Nurse Belle. She is a nurse navigator in the breast imaging department at the University of Texas MD Anderson Cancer Center. She delivers cancer prevention presentations all around the greater Houston area. She graduated from UT El Paso with her master's degree in nursing, and I'm going to turn it over to her and she'll tell us all about our topic and more about herself. We would like to encourage you to put questions that come up during the webinar right into the chat where Trevor Foreman can see them, and we'll address questions at the end. Sound good?
Yes.
Thank you.
Yes.
All right. Well, thank you so much, Paige. I appreciate that warm introduction. My name is Belynder Ouko-Kendrick. I go by Belle. I am the breast nurse navigator here at the Breast Imaging Center at MD Anderson Cancer Center in the Medical Center. And so my role is to help patients that are coming through our breast imaging centers for screening, for diagnostic procedures, as well as the patients who are currently in treatment or need to get directions through treatment. I remain their go-to person. I am that constant contact that you have, that you can reach out to for questions, for clarifications, for education, for support, and it's the entire journey. So the entire spectrum begins from screening, through diagnosis, through treatment, and to survivorship. So I am absolutely thrilled to have this opportunity to talk to you this morning. I wanted to make a few notes right now before we get started. We are in the age of pandemic here at MD Anderson Cancer Center. We are all required to wear our masks. So I just took this off so you can better hear me, but we all are doing our part in making sure that we prevent the spread of COVID-19. Also, as Paige said before, in order to reduce feedback, we are asking everybody to stay muted during the presentation. And then I also want this presentation to be very interactive. So I'll be asking you a series of questions as we go along. And I would like you to find your reaction button right now on if you're on Zoom and give me a thumbs up so I know that you can see me. Awesome. Thank you so very much. All right. So just an overview. Today we'll be talking about breast cancer and learning how you can reduce your risks. Some of the things that we'll be talking about include knowing some basics about cancer, some warning signs and risk factors for breast cancers that you can be aware of, some health choices that you as a person can do to lower your breast cancer risks. We'll also be looking at additional measures and tests that can be done to know your risk factors for breast cancer. And finally, we'll look at how important mammograms are to early breast cancer detection and helping cure it when it's at early stages when it's curable. All right, so let's get started. Again, as I mentioned, we are in the COVID-19 pandemic, so we have to do our part to stop the spread. We encourage everybody to continue maintaining social distance by staying at least 6 feet apart. You want to wash your hands thoroughly with soap and water at least for 20 seconds. You also want to make sure that you're wearing your masks. It can be a cloth mask or face covering. Whatever it is, it needs to cover both your nose and your mouth. And then finally, getting tested is very important. It empowers you to protect others. So if you have any access to getting tested, please take an opportunity to get tested. All right, so let's get started. We will talk a little bit about the evolution from cancer cell to tumor. The picture that you're seeing right now shows you normal cells that are well aligned, well behaved. They're all uniform, same in color. But then in the middle, you see there are different. There are cells that are different, and this is what we are talking about when we say that there is an abnormality somewhere. So cancer on its own is not a single disease, but a group of more than 100 diseases. And these occur when there is an uncontrolled growth of abnormal cells. So you look at these cells in the middle here, they're out of control. There's no order, there's no direction, they're doing whatever they want. This is what occurs when the abnormal cells grow, and then they collect together and they form tumors. When this occurs, we have tumors that can be benign, which are not life-threatening, they are not cancerous, or we can have cancers, we can have tumors that are malignant. Malignant tumors are cancerous and they have the potential to spread to other parts of the body. The process of spreading is called metastasis. Malignant tumors can be life-threatening. So these are the kind of cells that we want to make sure that we target during treatment. We can't talk about breast cancer without looking at the anatomy of the breast. The breast itself sits on the chest muscle above the ribs, or over your rib cage. Each breast on its own has lobules and lobes. So we have about 15 to 25 lobes, and inside the lobes we have the lobules, and in the lobules we have glands where milk is produced. Then the milk is then transported to the nipple through milk ducts. I want you to keep this in mind, because once we start talking about the different types of cancers, we'll be talking about the lobular cancers and we'll be talking about the ductal cancers. So just keep that in mind. We have 15 to 25 we have about 15 to 20 lobes, in which we have lobules which have glands where milk is produced, and then that milk is then transported to the nipple through the ducts. Also, we have lymph nodes. Primarily, we have lymph nodes mainly in our armpits. We have them in the collarbones. We have them in our chest behind the breastbone, and in many other parts of the body. Lymph nodes primarily function to trap bacteria and cancer cells and other harmful substances. So they play a big role in purifying and cleansing our bodies. So that is the anatomy of the breast. Like I said, I want to keep this very interactive, so I'll be asking a series of questions as we go along. So give me a thumbs up if you think breast cancer is the most frequently diagnosed cancer in women. Yes, that is correct. In fact, breast cancer is very, very common in women. It is the second most diagnosed cancer in women after skin cancer, and it's the second leading cause of death in women after lung cancer. So research shows that about 1 in 8 women will get a breast cancer diagnosis during their lifetime. So with that in mind, let's look at some signs that we can look out for so that we know what puts us at risk for breast cancer. The key to identifying and detecting breast cancer is mammogram. So mammograms are a very, very important way for us to find breast cancer early. And this is very, very important to improve your outcome. But also, in addition to that, we want you to know some signs and symptoms that you as an individual can be on the lookout for, so that you know when something is wrong and you can report this or discuss this with your doctor. So you want to look at any lumps or masses. If you feel something that is just not right, a lump, a bump, or a mass in your breast, that is concerning. If you have an enlarged lymph nodes. So remember, I said we have the lymph nodes, primarily the axillary lymph node or the armpit lymph node, function as a way to cleanse our system. So they get clogged with maybe cancer cells or something that is not normal. You will have some enlargement in your lymph nodes. So you also want to look at changes in the breast size or shape. Maybe one side is bigger than the other. There is not something that it's definitely not normal. So you want to look at changes in the breast size. Do you have any dimpling? Do you have any puckering of the nipple? Do you have any scaliness? Any other nipple changes or any nipple discharge, or even nipple pulling to one side or the other. These are some key risk factors or warning signs that you do need to discuss with your doctor. And please, please, please do not let COVID-19 hinder you from making an appointment with your doctor. If you have any of these signs that I've just mentioned, you want to make sure that you get to your doctor as soon as possible. And so just to recap that, you want to look at for any lumps or masses, if you have any enlarged lymph nodes, if you have any changes in your breast, any dimpling, puckering, scaliness, or any nipple discharge, as well as any change in direction of the nipple from one side to the other. All right, so with that in mind, let's look at different types of breast cancer that we see commonly affecting women and some men. You know, I said earlier when we started that breast cancer is not, that cancer on its own is not a single disease, but a group of many diseases. The same applies to breast cancer. Breast cancer is not just a single disease, but many different kinds. And breast cancer can be invasive, which means that it has spread to other parts of the body, or it can be in situ or contained. It hasn't spread to other parts of the body. So the most common form of breast cancer that we see diagnosed a lot in women is called ductal carcinoma. So remember when I talked about the anatomy of the breast, we have the milk ducts and then we have the lobules. So ductal carcinoma starts in the ducts that transport milk to the nipple. So when we have the cancer in the duct contained, it's called DCIS or ductal carcinoma in situ. When it's broken through the membrane and started to spread outside the duct where it began, it's called invasive ductal carcinoma. The second type of breast cancer that we have is called lobular carcinoma, and this begins in the lobules. Remember, I told you to recall lobules and the ducts. So the lobules is in the lobes we have lobules which have the glands that produce milk. This is where lobular carcinoma starts. This as well can also be in situ or invasive. In situ just means that it's contained, or invasive means it's spreading to other areas. Now, Black women get a very aggressive type of breast cancer that is called triple negative breast cancer. The term triple negative breast cancer refers to the fact that this cancer cells do not have receptors for estrogen, for progesterone, and the HER2 protein. So this type of cancer is a little bit challenging to treat as it doesn't respond to the common treatments that we have for breast cancer. And then the final type of breast cancer that I wanted to discuss with you today is called inflammatory breast cancer. Inflammatory breast cancer is also abbreviated as IBC. It's an extremely rare form of breast cancer. It's very, very fast growing and very lethal. And so often women mistake it for something else because it can appear like a rash, or it can also just appear like maybe an infection. And so most women tend to wait a little bit to see what's going on, if it's going to get over and recover, while meanwhile, this is a very fast growing cancer that's already spreading by the time it's typically identified. All right, let's get another question in. So tell me, do you think breast cancer occur in women of all ages? Yeah, you agree? So very true. Breast cancer actually does occur in women of all ages. And we are seeing a lot more younger women, so we cannot stress enough knowing yourself, knowing what feels right, so that if there is something that needs to be addressed, it's caught early. All right, so let's talk about some risks, things that can put you at risk for breast cancer. And just so you know yourself, you know your history, you know what to look out for. No one can truly tell you if and when you will get breast cancer, but there are factors that will increase your risk for breast cancer. So you want to be aware of this so that you are doing your part to prevent the disease from starting. Having one or more family members who have had breast and ovarian cancer is one of the familial tendencies that we have when we talk about risk for breast cancer. Inherited susceptibility genes like BRCA1 and BRCA2 mutations, these account for about 5 to 10% of inherited breast cancer cases that we see. So familial history, knowing if there's anybody in your family who has had tested positive for BRCA1 or BRCA2, that will be a good thing to know so that you can be on higher surveillance. Also, if you've had radiation therapy, especially to the chest during the ages of 10 and 30, that does increase your risk of getting breast cancer down the line. So in these cases, we'll monitor you a little bit closer than the average person. If you've had any diagnosis of lobular carcinoma in situ or a typical hyperplasia, these are diseases that put you at higher risk for breast cancer. So lobular carcinoma in situ essentially is still contained, it's a precursor to cancer. So if you have that, you are at an increased risk for breast cancer. Also, there are some reproductive factors that will put you at a greater risk for breast cancer. These are things like if you start having your periods or before the age of 12, so younger age of menarche, having your period when you're young exposes you to a hormone estrogen that puts you at a higher risk for breast cancer. Starting menopause late after the age of 55, that means you've had a long exposure to the hormone estrogen. So that also puts you at a higher risk for breast cancer. Also, if you have your child, your first child after the age of 30, or if you never have children at all, this is a risk factor for breast cancer because your exposure again to the hormone estrogen is over a very, very extended period of time. On their own, each of these cases does not really increase your risk factor for breast cancer, but if you have two or more, you definitely want to talk to your doctor because you might be at an increased risk. All right, now that we know those risk factors, let's look at some tips that we can take to lower our breast cancer risk. You want to be empowered and take charge of your life. And there are things that you as an individual can do to decrease your chances of getting breast cancer. So the first thing is keeping and maintaining a very healthy weight throughout your life. According to the American Cancer Society, women over the age of 50 who are overweight or obese have an increased risk of breast cancer. So you want to make sure that you eat a healthy diet and that you, to achieve this, you want to fill your plate with 2/3 of your plate with plants at every meal. Try to eat plant foods, vegetables, whole grains, things that are as close to nature as possible. And then also maybe fewer calories. You don't have to eat as much, and then you put in some exercise with a healthy diet and you'll be very in a good position. Also, in general, healthy weight, healthy nutrition, all of this boosts your immune system. And so this can help you fight off infection and even cancer. Activity, you want to get active, you want to sit less. Sitting too much increases body fat, and this leads to cancer and other chronic diseases. So you want to aim for about 150 minutes of moderate exercise, such as walking or yoga each week. If you like, you can do strength training exercises that you can at least do at a minimum 2 days a week. And then you also want to make sure that you reduce your stress. Some women report that exercise is a great stress reliever. So you do want to lower your stress while you're staying healthy, eating healthy, and exercising. And then another thing that you want to avoid or keep at minimum is alcohol. Not drinking alcohol is actually the safest choice. But if you choose to drink, you want to limit yourself to no more than 1 drink a day. So 1 serving equals about to 1.5 ounces of hard liquor, or 12 ounces of beer, or even 5 ounces of wine. Drinking alcohol alone can disrupt your sleep, can make it hard for you to exercise or eat healthy, and also has a negative effect on your immune system. So if you can avoid alcohol, that is the best way to go. And then earlier on, I talked about some risk factors for breast cancer. So things like choosing to breastfeed is very, very important, because during the time that you're breastfeeding, you are not having your period, which means that you have a less exposure to the hormone estrogen. So breastfeeding is not only good for the baby, it's also good for the mom. So you want to try to breastfeed exclusively for at least 6 months. 6 months after giving birth, and then you want to continue to breastfeed even as you introduce different foods to the child's diet. Hormonal changes during lactations not only delay the period, and this is really key. Reduction of that lifetime exposure to hormone estrogen is your key to reducing your risk for breast cancer. Also, during pregnancy and breastfeeding, you shed some breast tissue, which can help remove cells that probably had some DNA damage. So you want to get this out of your system. And then breastfeeding also helps your child it helps prevent your child from being overweight or obese later on in life. And again, obesity is a risk factor for not only breast cancer, but many other diseases. So breastfeeding your child helps them not be overweight later on in life. Women at an increased risk are certainly encouraged to talk to their doctor because there are things that can be done. There is hope. Don't despair. We want you to talk to your doctor because there are medical exams and there are medications that can be used, and there's genetic counseling that can be done as well. So if you have risk factors, please talk to your doctor and then get these issues addressed early. All right, let's get another question in. Give me a thumbs up button if you think a woman can develop breast cancer even if she has no family history of breast cancer. You agree? Yes, this is so true. Actually, more than 75% of women with breast cancer have no family history of the disease. I want to stress this again, as I said earlier. BRCA1 and BRCA2 mutation, which account for the genetic or familial tendencies or inherited genes for breast cancer, only account for 5 to 10%. So the rest of the breast cancers have no family history. So what is genetic counseling for breast cancer? So a genetic counselor is a provider that will meet with you. They will talk with you and review your family medical history, and then they will perform a hereditary cancer risk assessment. Based on that assessment, the genetic counselor then may recommend some genetic testing. Typically, it's a very easy, simple blood test that is done, and then the blood test provides us with information about any genetic mutation that you might have, such as, again, BRCA1 and BRCA2 mutations. These do increase your risk for breast cancer. So once you identify this, there are preventive measures that your doctor still might discuss with you. If you are at an increased risk for breast cancer, medications such as tamoxifen or raloxifene have been shown to reduce the risk of breast cancer in some women. Also, preventive mastectomy, which is the removal of one or both of the breasts, is another way that we can reduce your risk for breast cancer. All right, let's get another question in. Give me a thumbs up if you think treatment is more successful when breast cancer is identified early. Yes, this is true. In fact, in 96% of early breast cancers are treated successfully. This is why we can't stress enough that mammograms, especially after the age of 40, annual mammogram is very, very important. So this is Breast Cancer Awareness Month. We want you to make sure that if you didn't do it at your birthday, at least do it during October Breast Cancer Awareness Month. And we here at MD Anderson are available to help you. But please get your mammograms. This is the best way that we can detect and diagnose breast cancer early when it's most treatable. So you cannot miss out on that opportunity. All right, so let's talk a little bit about breast awareness. So in the past, there was a lot of push to do breast self-exam every month, and then there were a lot of issues with that. So here at MD Anderson, as well as other major organizations like American Cancer Society, the recommendation now is to be familiar with your breast. know what looks and feel normal. That is more important than focusing on breast self-exam. There's no right or wrong way to do this. Just knowing yourself, being intuitive, knowing what is normal for you is the key. And this shift has come about because breast self-exam confused some women. And so some women didn't do them at all. Also, research has shown that there's no benefit for a woman finding lumps or bumps using a certain technique. You just know yourself, touch yourself, feel yourself, know what feels normal, and that's all. So that if something is not normal, you can identify it right away. Further, MD Anderson breast oncologists observed that most of the patients reported finding the lump or bump or the breast cancer when they were going about their everyday business. So the key now is we've shifted from recommending the monthly breast self-exam to being breast self-aware. You want to know yourself so that if there's anything that is not normal, you want to report this to your doctor, especially if it persists for about a week or two. You want to make sure you talk to your doctor. And again, I cannot stress enough, don't let COVID-19 stop you from going to see your doctor. All right. Again, here's another question for you. Thumbs up button if you think mammography is safe. Do you think mammograms are safe? Yes, mammograms are safe. Actually, the dose of radiation that you get from a screening mammogram is about the same exposure you get from radiation in your natural surrounding. And this is called background radiation. This is over an average period of about 3 months, according to the American Cancer Society. So mammograms are safe, and we cannot recommend them enough. Early detection, early treatment, better outcomes. All right, so let's look a little bit deeper into what mammography is. A mammogram is an X-ray of the breast. We do different kinds of mammograms. There is a screening mammogram, which is a test that looks for breast disease in women without any breast symptoms. So you don't have any pain, you don't have any bumps or lumps or masses. You just come for your annual screening mammogram that you go to maybe at your birthday, or you go during October Breast Cancer Awareness Month, or you go anytime during the year. That's a screening mammogram, and you don't need an order for that. We just ask that you let us know who's your primary care provider that's going to be following you for those results. And then you just self-schedule and come and see us. We'll do your mammogram, screening mammogram, and then you're on your way out. Diagnostic mammogram, on the other hand, this is done for women who have breast symptoms. So you have maybe a lump, maybe you have a skin change, you have a nipple discharge, then we'll do a diagnostic mammogram. For a diagnostic mammogram, we will need an order from your doctor. So you'll have an abnormality or something that is not right, you go see your doctor will then order the diagnostic mammogram, and then you'll come to us for the procedure. So during the mammogram, 2 plates press on the breast just for a few seconds, and then it takes pictures. Lately, we have 3D mammography or tomosynthesis, which is an FDA-approved advanced technology that takes multiple images using X-ray of the breast, and it creates 3D picture of the breast. This actually is very, very helpful for our radiologists, as the 3D images can be sliced. So literally the doctor can look at every inch of the breast. And so this is making it very, very easier to detect breast cancer. The mammogram is very simple. You come in, you dress only from top up, and then our technologists will walk you through the stages of imaging and guide you and tell you what to do. So it's a very, very supportive environment, and she'll talk you through as she takes the pictures. So about 1 in 10 women that get a mammogram will need more pictures. Here at the Breast Imaging Center, I support a lot of women, because when you hear that they need more pictures, you start panicking. So that's where us breast nurse navigators, we're here to support you through that. Actually, most of the women who get called back for additional pictures do not have breast cancer. So don't be alarmed if this happens to you. Only about 2 to 4 women out of 1,000 that do a mammogram lead to a diagnosis of breast cancer. now that we know more about mammograms, you wonder, are there any other tests that you may need? Mammograms are key. I cannot stress this enough, but there are other tests that your doctor might prescribe, especially if you're at high risk for breast cancer. Typically, your doctor will order ultrasound or MRI that will be done along with your mammograms. And depending on your risks, you might be seen every 6 months or every 3 months. It just depends on what is going on, what are your risk factors. But we'll alternate mammograms and ultrasounds and MRIs as needed. And if you have familial tendencies or genetic mutations like BRCA1 and BRCA2, then we definitely do want to watch you a lot closer. Also, that goes into the first degree relatives. And so a first degree relative is a mother, a father, a sister, a brother, a daughter, or a son. So you want to make sure that you know your history and get tested, get genetic counseling, and then we'll monitor you closer. And of course, if you have that history of radiation, chest radiation therapy during childhood from between the ages of 10 and as well as up to age 30, you definitely will be watched closer. And so we'll do additional tests in addition to the mammogram for those kinds of patients. There are also other risk factors for which breast mammograms, in addition to MRIs and ultrasound, will be recommended. So definitely we'll work together with you and your physician, and they'll come up with a plan of care that best meets your needs. And so as we've discussed today, there are many things that you can do to help reduce your risk for breast cancer. The key is early detection when it's easier and most treatable. And here at MD Anderson, we are available to help you. We have self-scheduling, so you can self-schedule and come for a screening mammogram if you don't have anything. Also, we have an entire spectrum of cancer providers that can monitor you and work with you from prevention through to survivorship. So if you think you have cancer, or if you think you've been diagnosed with breast cancer, it's important that you get the right diagnosis from the beginning, and we are here. We will re-image you and will correct your diagnosis and prevent you from undergoing unnecessary procedures if not indicated. So we want you to get the right treatment, the right diagnosis, go to the right place, do it once. Screening, again, is going on. We don't want you to stay away or shy away because we are in the pandemic, but it is very, very safe at MD Anderson. We are all wearing our masks. We're doing all our part to keep you safe. Screening is available for everyone, especially if you don't have any symptoms of COVID-19, and then we'll provide you with masks when you come to our institution, and then we'll also space out our appointments so that we make sure that there is that social distance and we have time in between cases. So please schedule your mammograms, get tested, get screened, and do your part in maintaining your social distancing to help fight COVID-19 when you're getting your screening. Additional information that I can provide you is that here at MD Anderson, we have the Cancer Prevention Center. We have the Undiagnosed Clinic that will focus on treating any lumps or masses or things that might put you at higher risk for breast cancer and leading to diagnosis, and then we treat you, we send you through to treatment. And then we are located here at the medical center where I'm the breast nurse navigator, and then we have the Woodlands, we have League City, we have West Houston Diagnostic Center as well. And so we want to make sure that you know, we are in the community and we are able to serve you. So if you haven't had your mammogram, please get that scheduled. We are available, and I will put our contact information at the end of their presentation. And here we are. I wanted to know, do you have any questions for me?
Actually, Belle, we have a couple of questions.
Okay.
One is from Paige. She asked, regarding age and risk, does risk go down after a certain age, like after menopause?
Thank you so much, Paige, for that question. Actually, no. Age is, as your age increases, your risk for breast cancer also increases. The key is the amount of time you've been exposed to the hormone estrogen. So if you started your period early, before the age of 12, and then say you probably have your menopause late after the age of 55. So you've really had a long period of exposure to the hormone estrogen. Also, maybe during this period of time, you didn't have children or you had children late after the age of 30. So now your exposure to the hormone estrogen has really been over a long period of time. So studies show that as you age, so does your risk factor for breast cancer. And that's why one of the questions that I asked earlier was, do we think young women also get cancer? Yes, young women also get cancer, but the older you get, the higher your risks. We can't do much about that, but we can know our risk factors and stay on top of it, correct?
We have another question from Jenny. She asks, how often should a person over 60 get a mammogram?
So depending on what is going on, a mammogram is a screening that is done annually, so every year. So you go every year for your mammogram, pick a month that you can easily remember, do it on your birthday or do it on October, Breast Cancer Awareness Month, but you want to do your mammogram every year. If there's nothing, it's a screening mammogram and the radiologist will recommend return to routine mammogram next year. So you come back next year for your screening mammogram. If something is identified, then a diagnostic mammogram will be done, and then we'll figure out what is going on based on the radiology finding. They'll make a recommendation, and it can be either for a biopsy or a resolution of that finding. So they'll say, okay, we've done the diagnostic mammogram, everything's okay, it's benign, you can go back to routine screening mammogram.
And we have one other question from Lauren. She asks, once you have been treated and considered free of cancer, are your risks any higher or lower of getting cancer again?
So once you've been treated for breast cancer, you are at an increased risk. So we want to monitor you closer. Just the simple fact that you've had it puts you at an increased risk. So you will be monitored closer. And here at MD Anderson, we have survivorship clinics. So you will, once you're treated and you're cured, you transition onto survivorship. So you have providers that will work with you and monitor you. And typically, once you're done with treatment, you might still be continuing things like hormone therapy or other different types of therapies. So you will be monitored closer. So yes, having breast cancer, that does put you at an increased risk for another kind or a recurrence.
And then we have another question. 3D mammograms, are these much better than regular mammograms?
Yes, absolutely. So the 3D mammogram offers a better picture. It takes more picture than a regular 2D mammogram. And let me just go back to that slide and show you a little bit more. We actually, 3D mammogram is FDA approved. So I want you to think of a sliced bread, like a whole loaf of bread, and it's cut into different slices. What 3D mammography does, it takes a picture of the whole breast and slices it into different slices. So your doctor can actually see inside everything inch by inch. And so it does give the doctors a better picture of what is going on in the breast. And it's a lot better than the traditional 2D picture that we've been taking in the past. And typically, we offer this because it's now covered by insurance as well. So we ask patients if they want to switch to a 3D mammogram. It does give you a better picture of the breast. It makes it better, easier for our radiologists to see what's going on in the breast. And if you have dense breast tissue, this is the best way that they can actually see through the breast to identify what's going on.
I have one more question.
Okay.
If you see something, a sign that you don't like, which doctor should you go to? Your primary or your gynecologist, or what should you do?
So the best thing is to go to a doctor. It doesn't matter who. Typically, I say, who does your breast exam, your annual breast exam? You know, I have a primary care doctor, but I also have a gynecologist.
Right.
And so my gynecologist does my breast exams. So if I have any breast concern, I will go to my gynecologist. But you can also go to your primary care doctor. And some people don't have both. Your primary care doctor or your gynecologist is well equipped to order the additional tests that is required after an assessment. So definitely reach out to your doctor.
Great.
Yes.
Anybody else have questions? That was wonderful information, very well laid out. Thank you, Belle. We appreciate it very, very much.
Absolutely, my pleasure.
And we'll make
Yes,
this.
and I am available. Trevor, are you going to put out contact information? We have the Cancer
Yep.
Prevention Center, we have the Breast Imaging Center, and then we have our Undiagnosed Breast Center. So if you just want to come to MD Anderson for your breast imaging only, you can go, you can come to us, you can self-schedule, you can come, we do your screening mammogram, and then we'll return that result to your primary care doctor or to your gynecologist, and then they will review it with you and make the recommendations, and then follow you for that. Or if you have any findings, if you have any mass, if you have any lumps or things that need to be addressed a little bit further, we have our undiagnosed clinic paired with a provider. And so instead of going back to your primary care doctor or your gynecologist with your breast concern, we will manage your breast care only. So you come, we have providers that all they do is breast care. So you come to the breast center, you're paired with a breast doctor or a nurse practitioner or a team that just looks at your breast care. Then they will order all the tests that you need done. So if you need a mammogram, if you need a biopsy, if you need MRI, it will be ordered. Then you come to the imaging center and we'll take care of that. And then the same day that you have that imaging, you go meet with the provider and discuss your results. And so it's a very, very neat clinic we have here at MD Anderson.
That sounds excellent.
Yes.
Thank you. Well, I can't
And that
thank you enough.
that information's in the chat right now.
I see it. Great. Well, we can't thank you enough, and we will make this available, this recording, with lots of other women who couldn't join us at the moment, but we'll get this information afterwards. Any other parting thoughts, Belle or Trevor?
So my thing is, if you can do anything at all, please, please, please do your annual mammograms. Make sure your family members do their mammograms. Know your family history and know what might put you at risk for breast cancer. Taking care and taking charge of your health is the primary key. So reduce your weight, eat healthy, exercise, reduce your stress, and maintain a healthy immune system so that you can fight off any diseases and cancers. So I cannot stress enough, just doing your part in taking care of yourself. This is key.
I would echo everything Belle just said.
Yes.
Thank you so much.
All right.
I appreciate it.
Thank you. Thank you so
Thank you, guys.
much. Bye-bye. Thanks
Bye.
again.